All right. So I'm gonna, you can, let's see, turn off Dr. Thomas, and I get to take over these last couple minutes. I will say somebody did ask about the insurance coverage for LDN. It's few and far between that I've seen insurances cover. I thought his median price for about $45 a month was right on. You know, we have some, we are a little bit lower than that here at our pharmacy, and it depends on where you're at in the country and everything like that. But I certainly encourage you to use your local pharmacy and local compounding pharmacy. I want to share my screen if I can do this. It's the fun thing of Zoom and our modern technology is I get to connect with so many people over that are in so many different places. The hard thing is sometimes utilizing the technology, and especially if I'm talking and moderating at the same time here. So I'm going to interview a couple of our customers here momentarily, but I wanted to just give you a little bit of an overview of low-dose naltrexone from our perspective here at Norland Avenue Pharmacy, and NAP is our abbreviation for Norland Avenue Pharmacy. So our pharmacy itself is a combination traditional and compounding pharmacy. Compounding, again, is we are making the medication from scratch. And low-dose naltrexone is something that needs to be compounded. Naltrexone itself comes as a commercial drug, but it's typically 50 milligrams up to 200 milligrams, where we're talking of doses as Dr. Thomas referenced 3 milligrams. It could be 4.5 milligrams. It could be as low as 0.1 milligram. And sometimes we talk about ultra low dose naltrexone going even lower than that. But again, our pharmacies here in Chambersburg, Pennsylvania, for those that are local, we're in Wellspan building number 2. We do have 15 plus years of compounding experience. Our lab is PCAB accredited. That kind of means we've taken that extra step to be board certified. So what that tells you is you can trust what the products we are producing and making and dispensing for you. I'd like to mention that our core values here at the pharmacy are to be God-centered, family-oriented, and to have integrity always. And so, again, we've really focused on LDN over the past 2 years. For the first half of 2020, we filled 476 LDN prescriptions written by 54 different prescribers for a total of 149 patients. And we've added to that number since then. But 78% have reported that LDN has helped them. We have been following up with our patients. 11% weren't sure, and 11% said it didn't help. But I'm telling you, an 80% success rate is pretty outstanding when it comes to medications. But of our patients, 52% said they experienced no side effects from taking LDN. 33% said they experienced vivid dreams and sleep disturbances. But 100% of the patients who experienced side effects said the side effects resolved after a few weeks. So I just wanted to give you that a little bit of an overview. So now I wanted to interview for you guys 3 different of our patients, and see if I can get them on here. The first is a couple, Robert and Sharon Whitmer, who have been patients for some time for us. And let me see if I can get them on here. Had them up here earlier. Mr. and Mrs. Whitmer, are you there?
Yes.
There you are, and I can see you. Thank you. And I want to also see if I can get Mrs. Hoover up here with us. That might take me 1 second here to figure that out. I'm gonna so while I'm trying to get Miss Hoover on the phone with us here, Mr. and Mrs. Whitmer, can you each tell us why you're taking LDN?
I'll let my wife talk first. She had started it first, and she had the most success, so I'll let her talk first.
Okay. I have had fibromyalgia for 50 years, although I didn't always know that's what it was. And so I've struggled with lots of pain and inflammation and soreness. And I also was diagnosed with Lyme's, and I also doctored for that for 6 years with antibiotics. But that's been some time ago now. It's probably been 15 years since I've been on antibiotics, and I got on LDN, and I
About two
feel
and a half
like
years ago.
probably about 2.5 years ago, I got on LDN, and I feel like it has really, really helped me. At first, I wasn't sure, but the longer I took it, the more I feel like it has made a world of difference for me. And I actually feel younger and have less pain than when I was much younger. And I don't have near the inflammation that I did have. Used to be, I could never sit more than 45 minutes. And even then, I often had lots of pain before that. But now I can sit for longer periods of time, and I can sleep all night. And I don't have to go to bed with ice bags like I used to. And I don't have near the burning. I also earlier had shots in my hips and back for this. Yeah, and I used to have a lot of brain fog, and I don't feel like I have that at all anymore. And yeah, that's
Okay.
kind of my story.
Okay. Great. How about you, Mr. Whitmer?
All right. Since she had such good results, I figured I had to try it. And I had a lot of nerve pain. Fact is, I was on gabapentin like 9 to 12 a day. And that all went away very soon. I feel like it's decreased my inflammation quite a bit. I have a lot less pain. And we just went through COVID, and we both had a pretty mild case. So I don't know if it helped that or not, but maybe it did. I don't know. But I don't use near as much Tylenol as I used to. So yeah, we're very happy with it.
How long have each of you been taking it?
She started before I did. She's been a little over 2 years. I started probably 2 months after her.
Okay. And what doses did you start at, and what dose are you taking now?
We went to 1.5 and then 3. Now we're both at 4.5.
Okay. Are you taking any supplements to go along with your LDN?
Yeah, we take quite a few supplements. We take magnesium, CQ10, and turmeric, vitamin D3, omega-3s, multivitamin. Recently, we started colostrum. You ever heard anything about that?
I have, yes. Yeah.
We've been on colostrum, and it seems like that's been a help too. So we're thankful for the health we have for the age we are. So very grateful.
Good. And you're 76 and 74, is that correct?
No, 78 and 76.
78 and 76. So Mrs. Hoover, if you're on, I apologize. I have not tried to give you a call and to join you in, so I failed with the technology there. But side effects wise, so I'm just going to continue here with Mr. and Mrs. Whitmer. Side effects wise, what side effects have you experienced? Did you experience any initially, or are you experiencing any now from the LDN?
We had those weird, vivid dreams at first. But it wasn't terribly bad, and it didn't last real long, and I never have them anymore.
We still take it at night, though.
Yeah, we do.
You both take it at night?
Yeah.
Mm-hmm.
Yes.
And I think you said this in your present when you talked initially, but how long did it take to start seeing results?
I would say at least 3 to 9 months, in there somewhere. It took a while.
It did take some time, yeah. And
yes, it did.
Well, she's had this for 50 years.
Okay, sure, right.
Yeah, so I wasn't going to give up right away.
Good.
Because I didn't know anything else either. I had tried everything else.
Okay, very good. Anything else you'd like to share as we wrap up our time with you? I really appreciate your input.
No, we're just afraid to get off of it.
Okay, that's interesting. And what Dr. Thomas said too, a lot of his patients, they are, they want to be on it. They don't want to stop. I will say, I will say, I think sometimes what I've seen is sometimes people regress after some time, or it seems like the LDN stops working. And what we do in that case is we often have people stop the medication for maybe 3 days and then restart it. And it seems like that helps helps with that then. So
Well,
How do you know whether to drop back like from 4.5 to 3, or is
yeah,
that just a guess?
no, that's a great question. Typically, if the symptoms come back, or when people are titrating up, and this is a good question for everybody listening, as we titrate people up on dosage, if the symptoms come back or get worse, then we do tell people to go back to the previous dose. Normally, we're titrating people up by either a 0.5 milligram at a time or 1.5 milligrams at a time. And then again, if the symptoms get worse, then they come back.
I should say too, it's not that I never have a bad spell. I do sometimes, and I think, oh no, is it going to quit working or what? But then I get over them, and then I can be better for a long time. So it isn't that I never have the issue anymore. Yeah.
I would tend to think that if you even pause it for one day,
Okay.
that can help with the reset of it as well.
Great. I didn't know that. Okay.
So one of my helpers was looking for the last 4 digits of the number is 2461. I did not see that number up there. I was still trying to find Miss Hoover here, but I was not able to locate her. So well, thank you so much. I'm going to flip back. I'm going to share my screen again, and I'm going to shut your camera off. I appreciate again your input and in tonight's presentation. If anybody has other questions, type them into the Q&A as I wrap things up here, and I'd be happy to try to address them. Did you guys have any other comments or questions for us tonight?
I don't think so.
I
I really enjoyed the
enjoyed it.
presentations. We learned
Yes.
some things. Yeah.
Okay.
Yes, good.
I'm sure everybody will appreciate to know that Dr. Thomas signed off because he has an 8-year-old, a 6-year-old, and a 4-year-old, so that he was going to put to bed. So I think we're all,
there is,
yes,
excuse me, there is one thing I might say to you.
yes,
I heard you say that there's another form of LDN you could use a liquid if you have GI problems.
yes.
And I do have a lot of GI problems. I don't know if that would help me or not.
I think
She's
that's
always had those.
Yeah.
I think we could certainly try that. The other dosage form that we can use LDN in is a cream, and we pre-included a cream that will go systemic as well. So we use that with some folks. Now, LDN is really good for skin irritations, disorders of the skin, and so sometimes we'll use the cream just to apply on that area, but we can also use it that it gets driven into the bloodstream.
Okay.
So, but yes, let's try that then, Miss Whitmer. That's
okay.
Switch it to the liquid moving.
Yeah, I'd be interested in that.
Okay.
Thank you.
You're welcome.
She's had stomach problems for a good bit of her life, so it don't seem like it made it worse, but maybe it would help.
Yes. Okay. We'll give that a try.
Okay.
Right.
Thanks.
Thank you again.
Thanks.
All right, I'm going to wrap up here then. All right, so I'm going to share my screen again back to my PowerPoint. I'm sorry I left that up there. Again, sometimes with technology, it doesn't do everything that we want it to. So what are your next steps, you might be asking? Well, you can stop by the pharmacy, or if you want to send us an email, we can email you out some documents that you could take to your prescriber that explains that LDN is safe and basically how to use it. They give some dosage information for your doctor, and again, we'd be happy to talk with your doctor as well if they would like to dialogue with us about LDN. I'll jump down to the bottom point there, but if your practitioner is unwilling, we call it having naltrexophobia, where they're afraid of the naltrexone and don't fully understand it, we can refer you to a practitioner who can help. That we have multiple folks in the area that are prescribing for LDN. Again, there's the website for the LDN Research Trust.org. The books themselves we have here at the store. You can buy them here at the store for $22.99 each, regularly $27.99. Or if you want to buy them in combination and save yourself even more, they're $39.99 for the two together. So thank you so much for everything tonight. Before I sign off, though, I'm going to make sure that there are any other questions out there. Okay, and so somebody was asking me about the medication holiday. What I have seen for folks who see LDN working, and Amber and Lori, thank you so much for your questions tonight. What I've seen with LDN, if it stops working or not working as well, if people take a 3-day holiday and then restart it, they'll get those positive results again. I have also seen, and this is something I'm still learning about myself, is maybe 1 day a week not using LDN, and that seems to have the continued results as well. And I'm not sure again how that's working. Yeah. So the diagnosis for Mrs. Whitmer, I believe, came from a pain doctor. Let me see if they're still on here with us, and I can verify that with her. So the folks were asking about the doc. Mr. and Mrs. Whitmer, are you still there with us?
Yes.
Folks wanted to know who finally diagnosed you and what type of doctor they were.
We went to a chiropractor. What's it called? What's his name?
Oh, Dr. Jeremy's the one who suggested this to
Yeah,
us.
Dr. Jeremy Feeney. Yep, he was a chiropractor, and
yes,
he also has a medical practitioner with him. And he told my wife, he said, "Why don't you try it? Can't hurt you. Give it a shot." And that's how we get started.
Yeah, so that's Apex Chiropractic.
Apex, yep.
Yeah, on Fifth Avenue, and Dr. Feeney is a chiropractor, but he has a nurse practitioner that's overseen by a medical doctor that works with him and has diagnosed him. So if you need that contact information for Apex, give us a call here at the pharmacy on that. Okay. Thank you again. I thank you. I think that was all my questions then. And again, I wanted to just say thank you to everyone for joining us tonight. Thank you for their good questions. Thanks again to our presenters tonight. I thoroughly enjoyed this, and we'll look forward to seeing what we can do to help any of you. If you have questions, you can email us at the pharmacy at inquiry, INQUIRY @norlandrx.com. You can give us a phone call here at 717-217-6790. Thank you so much for joining us tonight, and we will look forward to meeting with you again sometime soon. Stop in for a pamphlet or give us an email. Have a good night, everyone.